Hello everyone, welcome back. My name is Dr. Vijay Bhatia. Today we are going to discuss about depression and we take a case discussion on low mood. You are sitting in your clinic and you are presented with a patient who complains of feeling low in mood. The question is, how would you establish the diagnosis of depression or something else? So ask the person some more details. How are you feeling? How do you feel in your spirits? How do you feel generally? How long have you been like this, the way you are? The patient may complain that I am feeling low in my mood. They might also say one or two other things, that I am worried, I have poor sleep, or something like that. And from what you see, the way the person appears, from appearance and behavior, you might think that person might be suffering from depression or anxiety or some other problems, and then it is your role to diagnose what kind of mental illness or physical illness is there that is contributing to feeling of low mood, feeling sad. So within short period of time you have certain ideas, and if you think that this person might be suffering from depression, you want to rule out all the other symptoms of depression by asking questions from the patient and also observing from their speech, their language, the way they appear, trying to establish. So let's go one stage at a time. So the first thing is, you want to establish whether this person is suffering from depression or anxiety or something else. Because we already have some suspicions and patient is complaining low mood, then you want to explore and ask in more detail. These are the core symptoms of depression. The person will say themselves or on exploring that they feel depressed in mood, that they have lost interest and enjoyment in the things that he used to enjoy and love, and they are not doing them anymore because they don't get any enjoyment from that anymore. And they may have reduced energy, leading to increased fatigue. That means if they do even small things, they will feel as if they don't have any energy, they cannot carry on the way they are, and it is obvious in their daily activities that they are not washing, they are not dressing, they are not eating the food, they are not cooking it properly, they are not going for shopping. So you can explore this more. Normally, for depression, you need at least one or two core symptoms to be present for at least 14 days minimum for the diagnosis of depression in a continuous fashion and is affecting their daily life. The other symptoms would be the biological symptoms and psychological symptoms. And then you can explore about their concentration and attention. Are you able to read the paper, read the book, watch the program, follow the program on the television? So they will complain some reduced attention and concentration. Explore about their self-esteem, about their self-confidence. Do they feel they can do things that they used to do, go and meet people, do the shopping and looking after themselves? You may find that they are presenting with low self-esteem. Doctor, I can't do this anymore. I am not capable of doing it. I don't feel that I have energy or confidence to do things. And they may even have ideas of guilt that they have done something wrong. I have hurt somebody's feeling. I have hit somebody. I have done something wrong. So they might feel guilty about something, and they might feel that they are not worthy anymore. They have done something bad. And even in mild depression, the feelings of unworthiness can be present. So it's important to explore this. They might have bleak and pessimistic ideas or views of the future about their self or about the world, that things are not going to get better. I've been feeling this for last month or last minimum 14 days. I'm not sleeping. Ideas of acts or self-harm or suicide. So they might be already thinking that I do not feel like living like this the way I am. I am not enjoying anything, so what's the point of living? They might be thinking of something, taking overdose or harming themselves to end their life. They feel the others will be better off when the person is not there. The person might complain sleep problems, normally diminished sleep. So we need to explore that a little bit more. Is it going to sleep is the problem, or is it the problem keep on waking up in the middle of night or waking up very early in the morning? That is a severe symptom of depression. If they first thing wake up in the morning quite early and feel really tired, anxious, lethargic, not able to face the next day, another day. They may complain of diminished appetite with weight loss. They don't enjoy the food. They don't want to eat. They feel sick, and therefore there is weight loss. So once you establish the symptoms of depression, then you want to establish the severity of the symptoms. So take the full history, how long the symptoms have been present. For depression, as we said, minimum 2 weeks of low mood plus other symptoms. How severe, then you look at the biological and psychological symptoms in more details. For mild depression, there might be only 1 or 2 core symptoms from feeling depressed, feeling lack of energy, and not able to get the pleasure out of things or enjoy things. So there might be only 1 or 2 symptoms from the core symptoms, but couple of symptoms from the biological symptoms like poor sleep and appetite, and some psychological symptoms like feeling of worthlessness, pessimistic views of self and others. In moderate depression, 3 symptoms from the core symptoms like depressed mood, lack of energy, fatiguability, and also loss of pleasure and interest. And in severe depression, normally there are symptoms for all 3 core symptoms and 5 or more symptoms from the biological and psychological symptoms, and to the severity. On top of that, they also have feelings of self-harm or suicidal thoughts. Then you want to see if they have severe depression. Is this severe depression without psychotic symptoms? That guilt feeling, is it just the ideas or their views, or are they totally convinced? If they are totally convinced with these kind of negative thoughts that they are not worthy at all, they are worth dying, they are not worth anymore, they are useless, helpless, hopeless, and if these are very firmly held convictions, beliefs, then they are suffering from severe depression with psychotic symptoms. Sometimes the depression psychotic symptoms can be nihilistic. They believe their intestines are not working, their brain is not working, and people are possibly putting the ideas in their mind or taking away their thoughts, and so they might be very, very depressed. And that will be severe depression with psychotic symptoms. You have to rule out the psychotic symptoms if you want to diagnose with severe depression without psychotic symptoms. Then you want to look at, is it the first episode or is it the recurrent episode in a recurrent depressive disorder. Again, then you have to specify, is it mild, moderate, severe with psychotic symptoms or without psychotic symptoms, or is it a part of the bipolar disorder in the past? Have they suffered from manic episode or hypomanic episode or mood swings that have been present? Even if there's a family history, you must rule it out to find out. But even to have one manic episode, then a period of normal mood, and then low mood, meaning they might be suffering from bipolar depression. So we need to treat this and manage this differently from the first episode of depression compared to the recurrent depression and bipolar depression. Establish the other symptoms of worry, because anxiety is very much intertwined with the depression, and sometimes worry and stress for some time may lead to the person to feel depressed. So it's important to look at the symptoms of worry. Is it just the worry, or is it more than that? The stress has gone right deep into their heart, and they are complaining of autonomic symptoms like palpitations, problems with breathing, sweating. Um, so ask them how long the worry has been present, what is worrying them. There might be some bereavement, there might be some separation, might be some loss of work or something that they might feel they may not be able to feed their children or sustain their life. And look at the anxiety symptoms, especially the palpitation, sweating, churning in the stomach, and they don't feel comfortable on their own or with somebody else. What are those biological symptoms and psychological symptoms? Look at the recent stresses for the bereavement, for the loss of something, separations from the partner, money problems, housing problems, relationship problems. They might worry about the self, others, or the future. And is this worry only specific to certain thing or certain place, or is it about general everything? The world is going to end. And is this worry a part of their depression? Did the worry start before, and how long before? And is it the anxiety that has taken the major hit, or is it the depression has been present before, and then over a period they started to worry more about other things? Do the mental state examination. What do we mean by this? This is the objective observation by the clinician. So look at their appearance and behavior. A depressed person may look sad, look worried, not dressed properly, or not even kempt properly. They may not have washed their hair. They may not have put the shave on. They might be putting the different clothes on, inappropriate sometimes. May appear weak, lethargic, worried, anxious, sitting on the edge of the chair or looking down on the floor, not keeping the eye contact. So you can tell this person is looking depressed and appears depressed. Look at their speech. It might be slow, it may not be spontaneous, it may not be fluent, they may not be coherent. They might have long pauses in the questions you ask them. They might have difficulty expressing their feelings or thoughts. Look their mood, and are they looking depressed? Are they looking worried? Are they looking anxious? Are they looking as if they didn't have the sleep for a long time? Do they look like they have lost weight? Their clothes are loose. And look at their thoughts. Are they slowed down? Can they think clearly? Are they worried? Is there any fear? Do they have any guilt? Are they negative about the self, about the future? Are they negative about the world? Do they have thoughts of self-harm? Do they have thoughts about ending their life, committing a suicide? Are they pessimistic? Are they worthless? Explore more into details. Are they convinced with these thoughts, or they are just ideas coming to them at certain times? Do they feel that they are trapped and they cannot get out of it? They feel helpless. They don't have any money to buy the food. They don't have money to buy the clothes. They will not feel safe. So explore all these things. Look for perceptions. Are they normally depressed person? Their thoughts are not very clear. Their perceptions are not clear. They look at other people and think that they can never get there. They will be never well again. They look black and white, and it is quite disturbing and distressing for them. So perception, and if they are psychotic, they might see something, a shadow or something, and get very scared and believe people might be after them because the perceptions are colored by the mood. If the mood is depressed, everything looks gray, either black and white, and the colors are dim. They don't enjoy things. And look for the orientation. Normally, they should be oriented to time, place, and person. That means they know where they are, who they are, what people they are meeting, and those kind of things. Insight. Insight is difficult sometimes with the depressed patients because insight means, do they understand what they are feeling and what they are believing? Could that be part of some kind of abnormality, or is it normal to think like that? If they say, yes, doctor, this is not normal, this is not me, I am usually happy and sociable person, but lately I'm not feeling that like that, I don't enjoy myself. Then you ask the question, does the person think that they might be suffering from mental illness or some kind of physical illness? And they might say it might be physical illness. And then you have to explore a little bit, could it be the mental illness like depression? If they say yes or no, depending upon how much insight they have, and if they feel yes, this is depression, they have suffered in the past, but to a milder degree, but this time it is worse and for longer, then you ask them, will they think that they need some kind of medication or treatment or help or support or talking therapy? And if they say, only then you say that this person has the insight. Otherwise, they might have partial insight, or they may not have insight at all, especially if they are suffering from psychotic disorder as well. They believe the things are going on for real. They are not going to survive the way they are, so therefore they are not worth it. So once you come to their conclusion, you are ultimately reaching somewhere to include the differential diagnosis. Could it be normal sadness? In normal sadness, the features are not consistent and not persistent. There might be periods when the person is with their loved one and they enjoy their company. But in severe depression, the person, no matter who visits them, they are really depressed, sad, they don't want to enjoy anything. So you have to differentiate. Could it be a normal sadness or part of the depression, severe depression or mild or moderate depression? And ask if there is a history of bereavement. How long ago was that? Sometimes the bereavement might have been 6 months ago, but they are still very much preoccupied by the thoughts of being with the loved one. They keep on doing things as if the deceased person is still there. So you have to explore, could it be the bereavement? Could it be part of the other mental illness? Recurrent depressive disorder, you have to ask the history in the past. Have you suffered depression, even if it is a long time ago? Explore whether it's a part of the bipolar disorder, as we discussed. Did they ever suffer hypomanic or manic episode in their life? Could it be cyclothymia, that they have periods of feeling high but not enough to qualify for the mania or hypomania, but then they have periods where they feel low in mood, and again that wasn't so severe enough to qualify for the moderate or severe depression, so they will qualify for cyclothymia or dysthymia, which is a persistent mood for 2 years of low mood but not severe enough to qualify for severe depression or moderate depression. It is milder form of depression for long periods of time. Or is it persistent mood disorder, and again for 2 years they have been feeling quite low in mood? Or is it part of the mixed anxiety and depression, that a lot of anxiety is there, the symptoms of palpitations, restlessness, agitation, breathing problems, churning in the stomach, not feeling comfortable. So all these things can be part and parcel contributing towards the continuity of the depression, anxiety. So unless we treat both anxiety and depression, the symptoms may not improve. Person might be suffering from PTSD, post-traumatic stress disorder. That person might have suffered serious attack or experienced some very severe trauma, and now the person is having flashbacks from those memories which were very traumatic, distressing, and because they've been persistent and cause the person to go into depression. Could it be part of schizophrenia, especially if they have psychotic symptoms, that people are after them to kill them and they're feeling depressed? Rule out any other organic causes like alcohol, illicit drugs. Alcohol, if you've been using for a long time, is a depressant, can cause real depression in people. Even if they're not drinking now, if there is a past history of long history of taking alcohol, but now they stopped in last couple of weeks, then they go into depression. It could be part of that. Or any other physical disorder, especially thyroid problems, liver problems, kidney problems, heart problems, anemia, B12, folic acid deficiency will cause all the lethargy, weakness, tiredness, and not able to do the things that they would normally do, or any other illicit drugs. Then you look at the biopsychosocial, look at their family history. Is there any family history positive for mania, depression, alcoholism, sociopathy, and previous history of depression in the person? Psychosocial factors, life events, loss, work, partner. Are they vulnerable? Are there any kind of disability, weak, old, very young, or quite stressful at work or school, college? It could be anywhere. Money problems. Do some investigations, especially to rule out all the biological causes of depression, like anemia, liver function test, thyroid function test, kidney function test, even things like calcium imbalance, hypoparathyroidism, hyperparathyroidism, hypothyroidism, all can cause depression. Any gynecological problems, chronic fatigue syndrome, gynecological problems, even are they pregnant, rule those things out. So look at the history of menstrual periods and take the history from the informant, how the person has been, and is the patient able to be stable and being looked after. Depending on the severity of the symptoms, that needs to be treated accordingly. If it is just mild, maybe just talking therapy or cognitive behavior therapy, relaxation techniques or mindfulness may help. More moderate will probably need some kind of antidepressants, maybe mostly treated by the GP, trial of one antidepressant then another antidepressant, and trying to look at if the person is complaining of brain sleep problem, may benefit from some sedative antidepressant. If the person is more anxiety, maybe from SSRI. If the patient is suffering from more psychotic symptoms, severe depression, then person need to be sent to the specialist. If there is any kind of suicidal thought, self-harm, then the person needs more specialist help with the psychiatrist. But normally, in the first instance, the doctor should follow the NICE guidance treatment of depression. I hope this has been helpful to identify the symptoms and realize that depressive disorder is a serious mental illness. There is no fault of the person, and this can happen in real people and can be treated. So get the right help and the right support and the right treatment from the specialist. Thank you for watching. If you like this video, please press the like button, share with friends, and subscribe the channel. There are more videos on mental disorders and how to identify mental disorders and seek the right help.